Hello, my name is Brian Dunford. I'm a second-year med student at OSU CHS, and our poster investigated the reporting quality and adherence to the CONSORT checklist of randomized controlled trials underpinning the American Academy of Orthopaedic Surgeons upper extremity clinical practice guidelines. All right, so given the importance of evidence-based medicine and its impact on patient care, it's crucial that clinicians have access to clinical practice guideline recommendations that are supported by sufficient evidence. Randomized controlled trials and systematic reviews tend to fit the bill for that evidence and are considered level 1 evidence by many prominent journals, and as such are used to support many of the recommendations made within clinical practice guidelines. Given this role that randomized controlled trials play in creating recommendations, it's necessary that these RCTs are well conducted and equally well reported. Yet despite this, previous studies have shown that randomized controlled trials in orthopedics and other medical fields often lack complete reporting. To combat this, CONSORT, which stands for the Consolidated Standards of Reporting Trials, released a statement in 2010 with evidence-based guidelines on how to report trials. This statement essentially provides a minimum set of items that should be reported in all trials. So for our study objective was to evaluate the reporting quality of randomized controlled trials used to support recommendations in the AAOS, Upper Extremity Clinical Practice Guidelines, using the CONSORT statement. For our methods, we searched the AAOS Upper Extremity Guidelines, including management of rotator cuff injuries, management of glenohumeral joint osteoarthritis, management of carpal tunnel syndrome, and management of distal radius fractures. Two investigators then screened the citations used to support the recommendations and extracted all randomized controlled trials from those clinical practice guidelines. Studies that were not RCTs were excluded. Each randomized controlled trial was then given a grade based on adherence to the CONSORT statement in a duplicate and masked fashion. RCTs were considered to have adequate adherence if greater than or equal to 75% of the items were met, and then statistical analysis was performed on the extracted data to include a multiple regression analysis. So our search of the 4 AAOS Upper Extremity Clinical Practice Guideline references yielded 690 returns. Of these, 299 were randomized controlled trials and subsequently included. Power analysis was run and yielded a random sample of 164 studies, which were selected for extraction. 64% of the studies were published after CONSORT guidelines were released in 2010, and mean adherence to the CONSORT guidelines was 67.3%. On the next slide I have a table, but RCTs published after CONSORT were more completely reported than RCTs published prior to the release of the CONSORT statement. Additionally, compared to studies reporting to have received no funding, RCTs that did not include a funding statement were less complete in their reporting. And this is that table that was mentioned on the previous slide, where you can see that RCTs published after the release of the CONSORT statement had more complete reporting than RCTs published prior, and that compared to studies reporting to have received no funding, the RCTs that did not have any funding statement were less completely reported. Given our data, we came to the conclusions that while there has been improvement in reporting of randomized controlled trials since the release of CONSORT, there's still room for improvement within the field of orthopedics, given the mean adherence. Additionally, we believe that increased awareness of these reporting guidelines, such as CONSORT, by journals and clinical practice guideline authors is a necessary step to improve the reporting of trial characteristics. And readers, researchers, clinicians, and patients all stand to benefit from randomized controlled trials and the clinical practice guidelines that they support to have a more thorough reporting. And if you have any questions, please do not hesitate to reach out to the emails on the screen. Thank you.